Now I am telling you the Viva question regarding hip bone. This is hip bone. The examiner will ask you, what is this? What is this bone? So you have to tell this is hip bone. Okay. Then tell me of which side it belongs to. Tell me the side determination.
Left side.
Why you are telling this is of left side? Tell me the basis. Okay. So as I know that it has got three parts, the ilium, ischium and pubis. The upper the expanded part should face upward. So this is superior and this is inferior. I can't hold like this. Expanded part should be superiorly. Okay. Now the cup set depression should face laterally. So this is lateral and this is medial. On the inferior aspect, short plate-like part of the bone should face anteriorly and short stout process should face posteriorly. And on the inferior aspect, there is a foramen, anterior to which is the short plate-like part and posteriorly there is short stout process. So this is anterior and this is posterior. For side determination, we should be aware of three things. What is superior and inferior? What is medial and lateral? And what is anterior and posterior? So this is of left side. Okay. Now the another question will be, tell me the anatomical position of this bone. How it lies inside the body. Okay. So you have to tell, sir, this is anterior superior iliac spine. And here is the pubic symphysis. This is the upper end. Upper end of the pubic symphysis and anterior superior iliac spine. Both should be in one coronal plane. Okay. First thing. Second thing, the pelvic surface of pubis, or you can say the posterior surface of pubis, should face backward and upward, like towards one's face. Yeah, who is holding that bone? Okay, so it should face backward and upward. Second thing, and third thing, that this symphysial surface, which forms pubic symphysis with the corresponding hip bone, it should be in the mid sagittal plane, in the middle and straight. I can't hold like this. In the mid sagittal plane, in the middle and straight, vertical. So this will be the anatomical position. Okay. Now tell me, what is this?
Iliac Crest.
Yeah, very good. This is iliac crest. Now tell me the attachment over the iliac crest. Very hit question. Attachment over the iliac crest. Then you have to tell, sir, this iliac crest is divided into ventral 2/3 and dorsal 1/3. This is ventral segment and this is dorsal segment. Ventral segment is somewhat broad and it has got outer lip, intermediate area and the inner lip. Outer lip has got attachment of fossa lata. All throughout in the outer lip of the ventral segment, there is attachment of fossa lata, which is nothing but the deep fossa of thigh. Okay. Then tensor fossa lata. There is one muscle named tensor fossa lata which lies in front of this tubercle of the iliac crest. Here in this area, in the outer lip. Tensor fossa lata. Just in front of this tubercle of iliac crest, there is one tract condensation of deep fossa, that is known as iliotibial tract or iliotibial band. Huh?
Yes, ma'am.
Another thing is the external oblique aponeurosis. Fourth thing is the external oblique aponeurosis in whole of the ventral segment, ventral 2/3 outer lip. And in the posterior 1/3 of this ventral segment, there is attachment of Latissimus Dorsi. So these 5 structure is attached over the outer lip of ventral 2/3 segment of the iliac crest. Huh? What are they? Just a mnemonic: fit XL. If you wear a dress, it can be fit or it can be extra large. Huh? So FIT, EX and L. F for fossa lata, that is deep fossa of thigh. Here this is iliac crest. Here it is iliac crest. And what are the attachment? Fit XL. This orange color is same as that of this. This is nothing but the iliotibial tract. I have said na, iliotibial tract. Yes. One condensation of deep fossa extending from just in front of the tubercle of iliac crest. Here lies. Just in front of the tubercle of iliac crest, there is one condensation of deep fossa. Very long. This is iliotibial tract or iliotibial band. Extend from the iliac crest up to the, this is tibia. On the lateral surface of the tibia, there is a tubercle. This is tibia. This is medial surface, and this is lateral surface. Here is one tubercle, not so prominent, but here is one tubercle like this, and this is known as anterolateral tubercle of Jerde, where this iliotibial tract is attached. Anterolateral tubercle of Jerde, which is situated on the lateral surface of tibia. This is medial surface and this is lateral surface. In its upper part, there is a tubercle where this iliotibial tract is attached. Same thing. This one is in orange color. This is iliotibial tract, and this one is fossa lata, which is nothing but the deep fossa of thigh, just like this. Suppose this is, here is the thigh, this is thigh bone, femur, and this is, here is thigh. So this one is deep fossa of thigh. So what is this? This is fossa lata, and this is iliotibial tract. Fi is clear. Now T, that is tensor fossa lata. This in yellow color, this one is tensor fossa lata, which is attached just in front of the tubercle of iliac crest here, just like this, in front of the iliotibial tract or tubercle of the iliac crest. वहाँ पे it is attached tensor fossa lata, fit and XL, EX, that is external oblique aponeurosis. In orange color, this one, these three are in orange color, this one is blue color, and this is yellow one. These are three anterolateral muscles of the anterior abdominal wall. This is abdomen. Here is the abdomen, this one is thorax, and here is the abdomen. There are anterolateral muscles and posterior muscles in the abdomen. So there are three anterolateral muscles, flattened, This one is external oblique abdominis. This one is internal oblique abdominis in blue color. And this is transversus abdominis. So, this external oblique abdominis, here it is attached on the iliac crest. And this is what? This orange color, this is the inguinal ligament. Inguinal ligament is what? It is the continuation of external oblique abdominis. That's why I have made it in orange color. This is nothing but the lower end of external oblique abdominis muscle, which get flattened and known as external oblique aponeurosis. And inwardly turned. Just look at, this is inwardly, forms depend part, which hold inguinal canal. Later on you will study inguinal canal, which rests on inguinal ligament. The base is formed by inguinal ligament in its medial to third part. There is inguinal canal. So what we have read, in the outer lip of the iliac crest there are 5 muscles: fit axle, F for fascia lata, this is transparent fit fascia lata, I for iliotibial tract, this orange color, T for tensor fascia lata, yellow one, X is external oblique aponeurosis. This one will descend down up to here and attach here, and in the posterior 1/3 of the ventral segment there is latissimus dorsi muscle. Here is this white one. This is latissimus dorsi. It also descend down here and get attached on the outer lip of the ventral segment. Okay, from posterior aspect. It is the superficial muscle of the back, latissimus dorsi. There are 2 superficial muscles in the back. Large one, latissimus dorsi, and trapezius. This one is latissimus dorsi. So, attachment clear on the outer lip of the ventral segment. Now, this is the intermediate area. Here in the middle, there is intermediate area which has got attachment of this second muscle. This blue one, it is known as internal oblique abdominis. As it is abdominal muscle, so abdominis. Internal oblique abdominis. Okay. Now, in the inner lip of the iliac crest, there is attachment of this third one, transversus abdominis. Very simple. On the outer lip, external oblique. In the intermediate area, there is internal oblique. In the inner lip, there is transversus abdominis. And also, in the posteriorly, as in the ventral segment as well, there is quadratus lumborum. Here in white color, forming the posterior abdominal wall muscle. Quadratus lumborum. First there is trunk. Normally what happens? In the body there is trunk. Then we wear inner. And then shirt or t-shirt like that. Yes. We dress up like this. So trunk is what? Transversus abdominis and quadratus lumborum. Trunk. On the inner lip. First there is transversus abdominis and quadratus lumborum. In the intermediate area, we wear inner first. Inner, that is the internal oblique. And then most outermost, we wear shirt. That can be fit or extra large. So fit is fascia lata, I for iliotibial tract, T for tensor fascia lata, X for external oblique abdominis, and L for latissimus dorsi. Clear? This is about the attachment of ventral segment of the iliac crest. Now coming to dorsal segment. It has got outer slope and the inner slope. outer slope has got attachment of gluteus maximus muscle, whereas the inner slope has got attachment of erector spinae muscle. Just look at here. This in blue color, this large one, big one muscle is the gluteus maximus. Just look at. It is also inserted over the iliotibial tract. This orange one is iliotibial tract, in which two muscle is inserted. Two muscle. This small one is tensor fascia lata. And this big one is gluteus maximus. Look at the beauty of this iliotibial tract. So, gluteus maximus. It is coming from that outer slope of the dorsal segment. Can you imagine? Yes, yeah. And an inner slope, there is erector spinae muscle. Here, you can see this yellow one. This yellow color. This one is thoracolumbar fossa. And in between the thoracolumbar fossa, just enveloped by this red color muscle, this is erector spinae, which is the deep muscle of back. Latissimus dorsi is the superficial and this one is deep. That's why it is going to the inner slope of the dorsal segment. Okay, now come to another question. This is only the answer of what are the attachment of iliac crest. Okay, you have told me all the attachment of iliac crest. Very good. Can you tell me any clinical significance of the iliac crest? Then you have to tell bone marrow transplantation. Very important. Bone marrow transplantation. We have to draw bone marrow from by inserting a needle. And we usually take from the iliac crest. And the second site is the sternum. So, very clinically significant. Okay, now the examiner will ask you, what is this? What is this? Tell me that this, name this area. So, you have to tell, and this is anterior superior iliac spine. Then, the other question will be, what is the attachment here? Attachment over here. So, is, is, this is a boy, is. So, is attached here and also is attached here. Anterior superior iliac spine as well as the anterior inferior iliac spine. Both are the favorite question of the examiner. So, what are they? Just decode. I for inguinal ligament. Lateral end, this is what we are seeing. This orange one is inguinal ligament. And what I am, this is anterior superior iliac spine. So, lateral end of inguinal ligament is attached over there. This is one I, inguinal ligament. And S is the longest muscle of our body. That is the sartorius, stellar muscle. Sartorius, which extends from the anterior superior iliac spine and coming to the medial surface of the tibia. That much of length. Sartorius. So, is attached over there. Now, what is on the anterior inferior iliac spine? I for iliofemoral ligament. This is ilia and this is femur. This is intertrochanteric line. This is greater trochanter, this is lesser trochanter. In between this, there is a line. This is known as intertrochanteric line. So, one ligament, ilio and femoral, extending from here to here, iliofemoral ligament, one eye. And S is a straight head of rectus femoris. There is one muscle here, it lies over. Rectus femoris is the kicking muscle, you can say kicking muscle. So, IS is I is for iliofemoral ligament, which is the strongest ligament of our body. Very important. The examiner will also ask you, tell me the strongest, name of the strongest ligament of the body. It is nothing but the iliofemoral ligament, which is attached over the anterior inferior iliac spine. It is also known as ligament of Bigelow. Bigelow. Ligament of Bigelow. Okay, now tell me, what is this?
Acetabulum.
Yeah, this is acetabulum. What structure overlies here? This is acetabular fossa. Fatty pad. Huh? Fat is there. Huh? Fatty pad is there. And what is this?
Notch.
This is acetabular notch. What structure passes from here? Another hit question. So first you have to tell that this articular surface, horseshoe-shaped articular surface, and this is notch. This notch is converted into a foramen by transverse acetabular ligament. There is transversely one ligament from this end to this end of the articular surface. This is known as transverse acetabular ligament. And now this notch is converted into a foramen by the union of this ligament, and beneath which passes acetabular branch of medial circumflex femoral artery and acetabular branch of obturator artery, going to the taking the blood supply for the head of femur. Here head of femur lies, and one ligament is also passing from here beneath this. From acetabular notch, one ligament is also passes, that is known as ligamentum teres of femur. Very important. The examiner will ask you, what is this? This is fovea capitis, and this is acetabular notch. Tell me, which ligament is passes from here to here? So that is ligamentum teres femoris, or round ligament of femur, carrying those vessels. That is the acetabular branch of the medial circumflex femoral artery and acetabular branch of obturator artery. And this is fovea capitis. Then examiner will ask you, okay, you have told round ligament of femur. Is there any other round ligament in your body? Then you have to tell, yes sir, in the uterus there is round ligament of uterus, and in the liver there is round ligament of liver. That is also known as ligamentum teres. And in the uterus it is ligamentum teres uteri. And here ligamentum teres femoris. Okay. These are the hit question. Now the examiner will ask you, okay, this tuberosity, what is this? So you have to tell this is ischial tuber. Now tell me the attachment over here. Then you have to tell that this is a comma-shaped tuberosity or inverted water droplet type tuberosity, and now it is divided by a horizontal ridge into upper and the lower part. Now upper part again divided by an oblique ridge into, this is oblique ridge, into superolateral and the inferomedial part. Superolateral part give attachment to semimembranosus muscle. Superolateral SL, semimembranosus M, salam. There is word salam, namaste. Yes, so salam. Superolateral semimembranosus. Inferomedial semitendinosus and long head of biceps femoris. Two muscles on the inferomedial and one muscle on the superolateral. Salam. Superolateral semimembranosus, inferomedial semitendinosus and long head of biceps femoris. And in the lower part, again divided by a vertical ridge into the lateral and the medial part. Lateral part give attachment to ischial head of adductor magnus muscle. Ischial, as this is ischium, ischial head of adductor magnus muscle. And medial part give attachment to the fibrofatty tissue on which we sit. If we sit, this part is attached on the surface and it transmits our body weight to the surface. Fat is attached over here. So this is about the, now another hit question. What is this? What is this? Tell me. So, sir, this is pubic tubercle. What is attached over here? At least you have to tell that is the medial end of the inguinal ligament. Medial end of the inguinal ligament, pubic tubercle. Another will be cremastric loop and anterior layer of rectus sheath. But examiner would like to listen only that much. That is the medial end of the inguinal ligament. Again he will ask that what is inguinal ligament? Then you have to tell it is the continuation of external aponeurosis, its lower end, the inwardly turned lower end of the external oblique abdominis, that orange one, abdominal muscle, anterolateral. Okay, now another hit question. This is greater sciatic notch and this is lesser sciatic notch. What structure passes from here? Huh? Greater sciatic notch, it is again divided into two parts by the piriformis muscle. Huh? Piriformis. Suprapiriformis compartment and infrapiriformis compartment. Supra, as for suprapiriformis and as for superior gluteal nerve and vessels, passes from there. And infrapiriformis compartment give way to pins, P-I and S, pins, 2P, 2I, 2N and 1S. 2P is pudendal nerve and posterior cutaneous nerve of thigh. 2I is internal pudendal vessel and inferior gluteal nerve and vessel. 2N is nerve to obturator internus and nerve to quadratus femoris, and 1S is sciatic nerve. All these structure passes from the infrapiriformis compartment of the greater sciatic notch. Now tell me the content of this lesser sciatic notch. Out of these pins, only one pin passes from here. That is the pudendal nerve, internal pudendal vessel and nerve to obturator internus. It is also there in the pins, but only those one pin is passing from here. That is pudendal nerve, internal pudendal vessel and nerve to obturator internus. And also one tendon, that is tendon of obturator internus. And this is pubic crest. It is also important, pubic crest. Superior border of the body of pubis is pubic crest. After pubic crest. So what structure is attached over there? Rectus abdominis, pyramidalis and conjoint tendon. PC, pubic crest, PC, Priyanka Chopra. RPC is attached over there. Recognize Priyanka Chopra. She is recognized all over. So, R for rectus abdominis, P for pyramidalis and C for conjoint tendon. Now, what is this? Rectus abdominis, pyramidalis and conjoint tendon. So, we have learned about the anterolateral muscles of the abdomen. And this is in between this here in the mid clavicular line, this anterolateral muscle get very flattened and become thin, and now it is known as aponeurosis. Here external oblique abdominis muscle, and here it is external oblique aponeurosis. Internal oblique aponeurosis. Aponeurosis is what? Flattened tendon. And this is transversus abdominis aponeurosis. Here at this side, in the mid-clavicular line, medially, it forms rectus sheath. This is anterior layer. Here is the now internal oblique again divided into two lamina, anterior lamina and the posterior lamina. This blue one is internal oblique, again divided into anterior lamina and posterior lamina. In between this, what is this muscle? This white one. This is the vertical muscle of the anterior abdominal wall. These are the anterolateral, and this is vertical muscle of the anterior abdominal wall. This is known as rectus abdominis. Rectus means straight. Abdominis means abdomen. It is in the abdomen and very straight. So rectus abdominis. And this is small one, green one. This is pyramidalis muscle. Pyramidalis. So it is attached over the pubic crest. Here it is. This is pubis, body of pubis. This is superior ramus. So it is attached over here. RPC, rectus abdominis, pyramidalis, and another one is conjoint tendon. Now what is conjoint tendon? Another hit question. So internal oblique and transversus abdominis, both at the lower end, they just intermingle, they mixed and form a tendon, that is known as conjoint tendon. Internal oblique, that is the blue one, and transversus abdominis, this yellow one, at its lower part, both intermingle with each other and form a tendon, that is known as conjoint tendon, which is attached on the pubic crest. Now examiner may ask you, what is this? This is? This is pelvic brim. It forms the pelvic brim.
Yes, ma'am.
Medial border of the ilium. Here is the pectineal line. So here whole of this is known as chelotic line, and this one is arcuate line. May ask, it's not so important. Only they will ask that this forms the pelvic brim. Below which there is lesser pelvis, above which is the greater pelvis. And what type of joint is forming in between the acetabulum and head of the femur? This is ball and socket type of synovial joint. Ball and socket type of, this is ball and this is socket. Ball and socket type of synovial joint. And this is known as hip joint or femoroacetabular joint. Femur and acetabulum, femoroacetabular or hip joint. Now, he may ask, what type of joint is formed in between the ilium and the sacrum? This is sacroiliac joint, which is a plain variety of synovial joint. Plain variety. Plain variety is also known as gliding type. Plain variety of synovial joint. And another hit question, this is pubic symphysis.
Yes, ma'am.
And what type of joint it forms with the corresponding hip bone? It forms the pubic symphysis. Secondary cartilaginous joint.
Yes.
All joints in the midline of our body is the secondary cartilaginous joint. So this one is secondary cartilaginous joint. Okay. So these are the favorite Viva questions.
Why is it called secondary?